email us or connect with us on social media.
Think it's okay to drive high? Think again. Drug-impaired driving is as illegal as drunk driving, and in Ontario, the penalties are the same. If police suspect you're driving under the influence of drugs of any kind, or a combination of drugs and alcohol, and you fail a roadside test, your license will be suspended immediately for up to 30 days. You'll pay a penalty of $198. And you can be charged with a criminal offense of impaired driving, the same as alcohol. Driving high is never okay.
Hello and welcome to the Rogers TV COVID-19 show. I'm Carol Merton, and before I welcome our guest to the program, I'd like to share a few thoughts with you. For those of you who watch the program, you know I'd like to give an update on the status of our community in COVID-19 with some words of encouragement. We are hopeful that we will be able to move forward to having restrictions lifted after the next few weeks. Meanwhile, the Public Health Unit reminds us that physical activity is important for everyone's well-being. As the weather improves, children are naturally drawn to outdoor activities, including parks and playground equipment. These are wonderful ways to remain active, and their safety from potential hazards, not only COVID-19, but also from the sun, mosquitoes, and ticks, is important. While outdoor recreation is strongly encouraged, the Public Health Unit reminds us all to continue to wear a mask properly, use a sun hat and sunscreen, and apply an appropriate bug repellent to help keep all of the family safe while outside. There is good news in the gradual decline in the number of new cases of COVID-19 in Grey Bruce. The Public Health Unit could not have done this without the help of the community, and they need us to keep up the good work. We can all agree that we want to make this lockdown the very last one we will have to go through, and we do not want any more extensions. We are looking forward to the lifting of the restrictions, but in the meantime, please stay the course by continuing with the 3 W's and the 2 A's recommended by the Grey Bruce Health Unit. Wash your hands, wear a mask, watch your distance, avoid travel unless absolutely necessary, and avoid gatherings. This journey has been long, and we are all very, very weary. The sacrifices we continue to make each and every day will bring us all closer to the finish line. Let us make this difference together. Thank you to the community for all that you are doing and continue to do. And on that note, I also want to thank and welcome Gary Sims, who is the President and CEO of Grey Bruce Health Services. Gary, welcome to the program, and a big thank you to you and all of the staff at Grey Bruce Health Services for all that you've been doing throughout this COVID-19 pandemic. I mean, it's been a long, long haul. How are you doing?
Well, thanks for having me, Carol, and so as always, it's nice to see you. And reflecting on your words a little bit there, hopefully I'll need some sunscreen for my head, because that's a definite. I will tell you, it has been a long haul, and you know, I'm happy to see some light at the end of the tunnel, and certainly extremely proud of the staff and the community, quite frankly, our physicians, for their leadership and for their hard work, and for all the things they do both at home, in the community, and at work. And you know, I can never say enough about those things, but I am grateful to be part of an organization that has successfully managed to navigate to date and work its way through one of the most difficult and complex challenges before healthcare and before our society for a very long time.
Absolutely. Now, since we chatted last, there's still additional things that you've done at Grey Bruce Health Services and some exciting new things. So I'm wondering if you can talk about, I mean, there's so much, but let's chat about the ICU and the fact that you've accepted COVID-19 patients from out of the area. And I believe that Sunnybrook has also assisted with help with the advice through ICU. Can you speak a little bit about that?
Yeah, absolutely. So, many of the things that we've had to do throughout the different waves, and we've had to adjust throughout the waves, and certainly coming into wave 3, the reality is that we saw a growth within the province and a fear that we might hit close to 1,000 ICU admissions from COVID across the province, and that fear was if we hit those numbers, we would overwhelm our ICU. So one of the things that we did was proactively work as sub-regions across the province, and we're part of that. As we are a level 3, we have a level 3 ICU here in Owen Sound, and so we had to move some patients around to our other sites for support. We had to expand our internal medical beds. We added 20 additional medical beds. We added 4 additional ICU beds. And with that, we had to shut down our surgeries, which was unfortunate, but a reality in order to manage the crushing pressures that were happening across the province. And we did that with the help and support of South Bruce Grey and Hanover, who sent staff to assist us, and plus, thanking our staff for redeploying and working in different areas of the hospital that they're not accustomed to, but did so in wave 2, but have done again in wave 3. And yeah, we saw for the first time in the province the movement of patients from the acute hot areas where the ICUs were overloaded out into the different subregions. And the Southwest, I will tell you, the Southwest region took, based on population weight and size, we took 30% of the population offload from the Toronto region, which is much higher than our own our population is about 25% weight. So we carried more than our weight in the Southwest. And we should be proud of that because we've really helped out with the movement of those patients. And you're right, our existing chief of staff, our ICU, Dr. Terry Smith, he works at both Sunnybrook and here and has worked here for over 8 years. Terry was kind enough and Sunnybrook was kind enough to allow us to second Terry because the pressures on our staff in the ICU are greater, required more physicians to manage both the additional medical beds, patients on the floors, plus the additional patients in the ICUs, and the acuity of those patients was greater. And so, with that secondment of Dr. Smith and with the local physician support and everyone stepping up to do their part, we've been able to provide a critical service for the province. And you're right, your comments earlier on around, we are starting to see we're turning the corner. We are seeing numbers across the province slowly decline. Unfortunately, they're declining at a slow rate for the ICUs, but what we're seeing in the community is really great news. The decreased number of infections that we're seeing, and the amount of increased vaccinations that we're seeing is also some great news. It's great to see people getting those needles in the arms and moving us forward. But, without working together both as a sub-region and as a region, and then within the hospitals, without the staff working together to manage the excess flow in the specific areas of the hospital, we wouldn't be able to get through this. So I can't be prouder of your staff that serve you here at Grey Bruce. So it's been a tremendous learning curve, a lot of flexibility and agility of the organization to continue to flex. And, Ontario is very lucky to have an acute care service that can adapt the way that hospitals have had to adapt. Long-term care got in trouble in wave 2, but in wave 3, hospitals really stepped up to kind of get us through that. And so again, credit to the community and all the things, doing the right things and following public health guidelines. and a great kudos to the staff and the physicians for doing all that they do.
You know, in conversations I've had with other businesses, you know, they've talked about pivoting. We think of healthcare as both a service and it's a business of giving care as well. And pivoting to be flexible to meet the needs, not just within Grey Bruce, but regionally has certainly been a hallmark of what Grey Bruce Health Services has done. And absolutely, resilience is the key word, but I'm sure people are getting weary. This is tough.
Yeah, the length of it is certainly a challenge all unto itself. And we are, for the first time, you know, in the Spanish flu, there was the effect of the Spanish flu and the different waves of it, and we are seeing waves, but there's also how long you care for people and how long the staff have to keep going. So you have the challenge certainly before the staff is to keep going long enough and being energetic and focused enough to maintain and not burn out. And on top of that, now what we're starting to see as we come out of the waves, some of the long-term effects on patients are becoming evident. So you'll probably hear more about that in the future as we start to come out of the actual, you know, the different waves. That the long-term effect on medical patients will start to become more evident and will be a burden into the future that we have to work with. So, you know, this isn't over by far, and we have certainly a surgical backlog that has been built over the last year. You know, we were closed for 5 months in wave 2. We've been closed for a few months in wave 3, and we now have to do a lot of catch up over the next 2 years. So, you know, my staff may be done, you know, or getting close to being done with COVID, you know, as we finish this up. But then we have 2 years of catch up. So there's no rest for us, unfortunately. We seem to have to continue to perform, and that's maybe difficult for the community to understand as they, you know, they crave the beaches, they crave the sunshine. I will tell you, my staff probably crave rest. They crave not facing fear every day. And perhaps even to some degree, they crave normality within the healthcare system. So.
And for me, you know, I can't even imagine how much this has been challenging for staff. And that's why we encourage the public to stay following those guidelines, to do it for themselves, but to do it for the healthcare providers who every single day are facing this challenge, because they need to see the end of this as well, or at least to see a transition. So you mentioned what I've read as being the long haulers, which is the phrase they seem to be using a bit. We think of people getting over COVID, but you're implying that maybe there will be a group of people that will need ongoing care because of longer term effects of the COVID virus. How will that be provided? Because that will certainly take resources by the hospital. Are there conversations about that, Gary?
Yeah, there are conversations. We know coming out of the Spanish flu that there were some unusual parkinsonisms and some different diseases that came out of it that were recognized, or syndromes that came out of it following that outbreak. And this is no different. We are seeing people that are definitely what they're calling long haulers, but they're a little bit more complex. They're taking a long time to recover. There's some stuff that seems to be coming out with children that's being identified through the pediatric hospitals. So we will definitely see an effect of this. What that will mean has yet to be determined. How we'll respond to it. We're just starting to discuss that, because even as we come out of this now to try to ramp up to do our surgeries, we're recognizing that people who have come out of ICU, many of them are now in medical beds and having to, you know, re-strengthen, learn to walk, get dressed, do all those things, which they haven't, you know, before they were fully active, and now they're in such bad shape that they'll take a long time before they recover. So, you know, if you're so fortunate that this has not touched you or your family or your friends, then that's fantastic. But have no doubt, where it has touched people, it's a very real thing. And for those who had the short burst illness and came out of it, you're lucky. For those that are now burdened with the challenges, we have to help those folks get back on their feet, quite literally.
Yes, and that's an important message, absolutely, to share. So there is some positive news, I gather. I understand that there may be a plan for a CT scan machine in Southampton. Let's talk a little bit about that.
Sure, absolutely. Happy to talk about good stuff. That's always nice to talk about. And believe it or not, the COVID stuff is good stuff. You know, we've managed our way through it. So it is very positive that we're heading in the right direction. And people here are starting to get it. The staff here are getting their second shots this week, which is really good news for us too. And most recently, we got some really good news that Ontario Health is in full support of the new CT scanner in Southampton, which is fantastic for us. We do a lot of diagnostic work, as we should, because we're one of the regional centers. And the reality is, CT scanners in smaller hospitals like Southampton make a lot of sense, and they're definitely an intricate part of the future diagnostic planning for the region. And so we're pretty darn excited about a new CT scanner, along with pretty excited about the Markdale build moving forward. That's more good news. They've stripped the land. Most of the sewers and the services are in place, and they've started some foundation work already. So we're pretty excited on a couple of fronts. And we're no longer just focused on COVID. So it is a pleasure to talk about some of the good things.
Absolutely. Now, if things move forward with the CT scanner, and I know all things take time, but can you give us a ballpark figure of when you think it may actually be in place?
Yeah, the expectation now is that it'll probably arrive in 2022.
Yeah.
So we still have to go through a couple of more levels of approval with the ministry, and we have to go through a request for a proposal, for the purchase and the builder for the renovation pieces. So another year of ministry approval, and then getting those pieces in place, and then actually, believe it or not, the actual build and putting it in place does not take very long. It's the quicker part of this process. The approval process is longer than the actual putting it in place. So the later part of 22 is when I would expect it to be up and running.
So that's certainly a positive, and positive in so many ways. So you mentioned about the staff sorry.
No, it's okay. I was just going to say that, people underestimate a CT scanner is a key piece of diagnostic equipment that today physicians rely on. And, in Southampton alone, in their emerge, they see 17,000 people a year, I think, close to that number. And when you see a patient like that, you have X-ray as one of your major tools, and of course you have blood work and lab work. But a CT is a confirming tool that's used to determine whether you need surgery. And the concept of being able to use that, which physicians are trained on today and expect to use it as a top-notch piece of state-of-the-art diagnostics to make their decisions for treatment. It speeds up the treatment for the patient. It means less transportation back and forth, and greater clarity for the physicians in making decisions. So, if I had my way, I think there should be a CT in every small hospital, because every small hospital that has an emerge truly could use a CT, right? And I recognize it's very expensive, and I recognize it's very difficult, but I think we're very fortunate to be getting one in Southampton.
For sure, for sure. Now, we are anticipating growth in Grey Bruce, and maybe a little faster than we expected with the transition from the larger centers to our wonderful area. Well, how do you foresee that, the impact of growth on Grey Bruce Health Services and also on the physician supply?
Yeah, it's a great question. Most recently, many of the municipalities have been reaching out about physician recruitment. I will tell you my experience in working across the province. Grey Bruce has been very successful in its physician recruitment. I mean, you have one of the greatest advantages in the province, which is you have one of the most beautiful places in the world to live. This is absolutely stunning here. Maybe people who have lived here don't understand that, but the COVID experience, I think, has created an even greater advantage. While it has certainly started a movement of people out of the city into some of the most beautiful places, and this is one of them, it has started that same movement with physicians. So I think we're positioned well for the future for physicians. Most recently, we just hired a gerontologist. We just got approval to hire another pediatrician, another obstetrician, 2 new psychologists. And we certainly here are heavily focused on specialists because, as a regional center, specialty care is what we provide to all the region. But we are also keenly astute to the need for GPs, the key role they play as general practitioners within our small hospitals. I mean, I can't tell you how that's a keystone part of what we do. And so while that's important to primary care, it's also important to acute care. And so we're very much a partner in that piece of it. And I'll tell you, again, I think that we're well suited for that. Having a regional center close by for the smaller hospitals, plus the ability to offer a beautiful place to live, a balance of lifestyle, a choice for where the physician can work and the type of work they can do, I think we're well positioned for the future. On the growth side, we most recently took up some clinical planning processes with our staff, which is the first time it's been done in, I think, 18 or 20 years. And the concept there is to look at what is our future and what do we need to develop both for our population needs, as well as looking at our resources and human resource demands. And combined, I think we've come up with a very good plan that puts us in a good place. And I will tell you, in the next year, it's our expectation to go out for strategic planning and bring in all our partners and to determine some of those great questions you just asked. What are our needs for the future? What do we want to focus on? What do we want to develop? And taking for the first time a more proactive approach rather than a reactive approach. Much of healthcare has been reactive and shrinking and always tightening the purse strings. What we're doing now at Grey Bruce Health Services is looking at investing, growing, developing, and purposefully planning to move forward strategically in the right direction to meet the needs of the population, but also needs of the future population. Mm-hmm. And that for me is a key strategic difference between just reacting and being so positive and proactive.
And that sounds to be looking ahead is so critical, but you mentioned it's a clinical planning. So you've used your internal experts, the content experts who deal with these issues, to start the groundwork towards a larger strategic plan. Because the boots on the ground are the people who can see the directions, right? They literally have the pulse. And it sounds exciting to hear you say about the potential for proactive health strategies, because that's certainly a progressive approach, and I'm sure it would be exciting for people to be part of being strategically moving forward.
Yeah, I'm a great believer in ground up rather than top down. And the ground up piece, physicians, clinicians, frontline staff, they know what we do every day, but they also know what we're capable of. And I think, when you add the pertinent data from research and strat planning and from data for population health, you create a platform that helps them to see what an exciting future can be. And I think that's another piece of drawing in and attracting physicians, as you just said, mm-hmm. And it's not just physicians, it's respiratory technologists, it's lab technicians, it's physiotherapists, speech paths. Almost everything you do today is a multidisciplinary team, and you need all of that expertise to make that team work for the future. But you need to have a clear vision. You need to be an organization that embraces change and growth and takes on the challenge of not backing down from what's existing within our future and instead embracing it. And I'll tell you, the energy, the positivity, the foresight of the staff and the physicians and the leadership and the board, quite frankly, is fantastic for me. I mean, the reason I came was this, and it's so great to see that enthusiasm in a time where we're faced with such a big challenge like COVID. We're still able to see a future and be ready to boots on the ground coming out of this. You know, add the CT, add the new hospital, and it's pretty darn bright at Grey Bruce Hospital.
Amazing possibility thinking, and that's so wonderful for our community, for sure. So a couple of things. Yes, surgeries have had to be placed on hold, and you know, we had talked in the past about people delaying care. So we have just a few minutes left in the program. I'm wondering if you can talk a little bit about how you anticipate that surgeries will reopen, and are people still delaying care?
Yeah, that's two different things, but you're absolutely right. So on the delaying care side, we'll tell you, we again through wave 2, we saw a decrease in people in emerge, which is worrisome for us. No matter what we do, we keep telling people, if you're not well, please come in, because you know there are still strokes, heart attacks, all of those pieces that need to, cancers that need to be looked at. And unfortunately, if you're not being seen by a doctor, you're not being seen by or tested and scoped and checked for these different things, we're not going to find them. And so we do have a real worry that, you know, post-COVID, we are going to have this group of people that are much sicker over a longer period of time that need more care. So very worried about that. And again, encouraging people to please come forward and still get your vaccine. You know, sorry, what was the second part of the question?
So the other one was the surgeries, how you anticipate the rollout of the surgeries.
So surgeries, we are looking at it as a province and across regions, and we are trying to do it in a way that wherever we can open, we will open. So in other words, if hospitals are capable of opening and doing more surgeries, they will be doing them. The reality is it'll have to be gradual, because we're still under a lot of pressure in our ICUs. And so we will not get out of the ICUs quickly under that pressure. So we will probably start surgeries that are not going to take up ICU resources and that are not going to take up beds. But we will be doing it region by region, site by site. We're pretty fortunate. I think we've got a really good active surgical and surgeon group and surgical nurses who will ramp up pretty darn quickly. And I think by fall, we'll see a full ramp up, hopefully to full surgeries. And that's as long as we're getting enough vaccines in arms and we're continuing to see the downward trend across the province. And then it's my hope that we have that last 6 months of the year to make up for what we lost in the 3-month closure coming through wave 3.
Excellent. So certainly, as you say, as we move forward with the vaccine rollout, and we also have a deliberate approach to how the surgeries occur based on ICU beds, that there is optimism and hope that maybe this time next year we won't be talking about the closure of beds and that. So, Gary, as always, it's a pleasure to speak with you. You always have so much information. And again, I can't thank you enough, and your staff, and certainly all of the physicians who provide the care for what you're doing in these very challenging times. I do hope that you yourself will take good care and get a little rest somehow in the middle of all this. So thank you,
Carol. Thank you for your support, and thank you for your program. Your message is so important to us, so I really appreciate your time today. Thank you.
My pleasure. And thank you to our viewing audience for joining us today. Please join us again to learn more about programs and services available to you and to your family. Take care, stay safe, care for each other. Thank you.